Greetings, I am Augustine Simon, Bachelor of Physiotherapy, third year at Marward University. And today I'm going to talk about MCA syndrome. MCA syndrome is the abbreviation of middle cerebral artery. Now, middle cerebral artery is one of the two main branches of the carotid artery. For simplicity, if you want to know about carotid artery, just touch at your neck and you will feel a certain pulse. This is carotid artery. Now, among the two branches of the internal carotid artery, one of it is the middle cerebral artery. Middle cerebral artery supplies the entire lateral aspect of the cerebral hemisphere. Here we're talking about the frontal, temporal, and parietal lobes. Not only that, even the subcortical structures of the brain. As I said previously, that the occlusion of MCA is one of the common causes of stroke, or major causes of stroke. Now, the occlusion of the proximal MCA can produce cerebral edema. Not only that, when it leads to increased intracranial pressure, it can cause loss of consciousness, brain herniation, but also this one can lead to death. When it affects the primary motor cortex and internal capsule, it causes the contralateral hemiparesis. This one may involve the upper extremity and face. Not only that, when it affects the primary sensory loss and internal capsule, it can cause contralateral hemisensory loss. This also involves only the upper extremity and face. It can also affect speech. It can cause speech impairment. But this one when it affects the Broca's cortical area of the brain, especially in the left hemisphere. It can lead to speech impairment. Now this one is divided into three parts. The first one, when it affects the Broca's cortical area, here it can cause motor speech impairment. And this one can be only Broca's or non-frontal aphasia. The second one, when it affects the Wernicke's area, typically in the left hemisphere, this one can cause receptive speech impairment. It can be associated with fluent aphasia. Not only that, when it affects both the third frontal convolution and posterior portion of the superior temporal gyrus, it can cause the global aphasia. This one is associated with non-fluent speech with poor comprehension. It can lead also to perceptual deficits. Here we're talking about unilateral neglect, depth perception, spatial relations, and agnosia. Not only that, there may be the loss of conjugate gaze to the opposite side. Here we are talking about your eyes to look together in the opposite side, like this, when I'm changing my eyes. This will happen when the frontal eye fields or when the descending tracts are affected. Also, the ataxia of the contralateral limbs or sensory ataxia if the parietal lobe is affected. Now, we can summarize like this. The most common characteristic of the MCA syndrome is contralateral spastic hemiparesis and sensory loss of the face, upper extremity, and lower extremity. But what happens here is this sensory loss and contralateral spastic hemiparesis, it will be more to the face and upper extremity as compared to the lower extremity. Not only that, when the lesion happens to the dominant hemisphere, here we're talking about the left hemisphere, it will produce the problems with aphasia. Aphasia is the difficulty in speech. But when the lesion happens to the non-dominant hemisphere, here we're talking about the right hemisphere, what will happen is perceptual deficits. Perceptual deficits, here we are talking about unilateral neglect, anosognosia, apraxia, and spatial disorganizations. Thank you.